Foaling, the birth of a new horse, is one of the most beautiful and nerve-wracking moments for any horse owner. But sometimes things don't go as smoothly as planned. Just like in humans, complications during a mare's labor can happen quickly, and that's when veterinarians step in to save both mare and foal. Let's explore some common birth complications in horses, and how vets help bring those precious new lives safely into the world. Normally, foaling happens quickly, within 20 to 30 minutes once the water breaks. The foal should emerge front feet first, one slightly ahead of the other, followed by the nose and head. But if the mare struggles for longer than 30 minutes or shows signs of extreme distress, it could mean dystocia, the term vets use for a difficult or obstructed birth. One of the most common problems is malpresentation, where the foal isn't positioned correctly. Instead of coming out front first, it might be sideways, upside down, or even backward. This makes it nearly impossible for the mare to deliver on her own. Another serious issue is red bag delivery, when the placenta detaches too soon and the foal is deprived of oxygen. This is a true emergency. Every second counts. Sometimes the umbilical cord wraps around the foal's neck, or the foal is simply too large to pass through the birth canal. Even mares who've foaled before can suddenly face these issues, especially if the foal is oversized or the mare has underlying health problems. When complications arise, veterinarians act fast. First, they'll assess the position of the foal by carefully reaching inside the birth canal. If the foal is misaligned, the vet will attempt to manually reposition it, a delicate process requiring both strength and precision. If that's not possible, the vet may perform a controlled vaginal delivery under anesthesia, allowing the mare to relax while they safely adjust the foal's position. In extreme cases, a cesarean section might be necessary, though rare. It can be life-saving for both mare and foal. For red bag deliveries, the vet immediately tears open the placental sac to allow the foal to breathe, then provides oxygen support and resuscitation if needed. Once the foal is out, vets monitor both mare and baby closely, checking breathing, heart rate, and making sure the foal stands and nurses within the first hour. Even after a successful delivery, complications can continue. Retained placenta, internal bleeding, or uterine infections can threaten the mare's recovery. That's why vets often administer antibiotics, fluids, and anti-inflammatory drugs, and ensure both mother and foal are stable and bonding well. Early veterinary intervention makes the difference between tragedy and a healthy new life. For horse owners, the key is observation and preparation, knowing what's normal and when to call for help. Bringing a foal into the world is a miracle, but it's one that requires respect, readiness, and sometimes a skilled veterinary hand. Because in those tense moments, every heartbeat matters. Pause. This is your reminder. Always have your vet on standby when your mare's due date approaches. It could save 2 lives.